21 years ago, in Abuja, leaders congregated here and agreed that the Ministry of Finance should allocate 15% of the budget to health. 2 decades later, we haven't done much. Only 6 countries in the duration of this time have ever reached the 15% mark at one time or the other. This shows the declarations are good, but if the implementation does not work, then you have a dented health system. So there's a lot to go, but I wanted to cover 2 points. Leadership is important, and the second is finance.
Hello and welcome to another edition of Nigeria Health Watch's Curated Conversations series, a platform for leading voices contributing insights to shape global health issues. My name is Emeka Ogwano, and today I am joined by Dr. Amit Thakker. If you may introduce yourself.
That's right. I am Dr. Amit Thakker. I'm the Executive Chairman of Africa Health Business. I'm the President of Africa Healthcare Federation, and I'm also the Chairman of the Kenya Health Professions Oversight Authority with the Ministry of Health Kenya.
Fantastic, and you're welcome to Nigeria.
Thank you.
Yes,
it's a pleasure being here.
And this is ahead of the Africa Health Business 2-day annual symposium.
That's correct.
Taking place in Abuja.
It's the 11th edition of the symposium, and this is the 3rd time we're doing it in West Africa. We've been to Dakar, we've been to Accra, and now we are here in Abuja. We've been so excited coming to Nigeria and bringing the 11th symposium here. It's an absolute pleasure.
Yeah. And I mean, it's very interesting to know that this is the 11th edition, really. And, it just shows how much Africa Health Business has invested in this space. And you yourself, you've been at the forefront, championing private sector engagement in health system strengthening in Africa. And we really like to understand, what motivated you in this journey and why you think private sector engagement and leadership is crucial to strengthen Africa's health system.
Thank you for giving me that opportunity. I trained as a doctor and qualified in around 95, like many other people on the continent, became doctors to serve. And in my service during the first year at a public hospital, I realized that the health systems are weak. And it was immediately at that time I knew that I wanted to use my private sector acumen to improve and strengthen health systems. I founded a hospital group and a healthcare group. I started with a mobile clinic in 1996, Avenue Healthcare. We started with 2 staff, and eventually we had almost about 800 staff, and we were serving lots of people across Kenya. In that journey of my entrepreneurship, I realized that the public and private must work together to build a stronger health system. One can't function without the other. And this dual mix, the mix of both public and private, was something I was very passionate about. So I continued building up what we call groups of people within the private sector. We created Kenya Healthcare Federation, which was the first federation around that region. And we went ahead and, spoke to Uganda, Ethiopia, and Tanzania had already started a hospital association, moved into bringing them on board, Rwanda. So the idea was that if we came together, we would be stronger with our advocacy and changing policy to create a more enabling environment. We went ahead and built a similar model in West Africa. So we now have several countries, almost 28 or 29 countries in Africa, that believe that private sector coming together plays an important role in PPP and building up a stronger health system. So this is a journey we've been walking from a long time. So in my private sector life, besides running hospitals and clinics and mobile clinics, I've also ventured into health insurance and very recently started this company called Africa Health Business, which is a health management consultancy firm that offers consultancy services and also capital services. And through this, We look forward to building an entire strong ecosystem in Africa that will help private sector do more, impact more, and engage more with the wider stakeholders on the continent. So AHB is really a company which plays like it's a catalytic organization. It sits right in the center of bringing different private sector players onto the continent and works with them to offer their strengths in strengthening the health system. And our partners include organizations like WHO, you'll see them here, Africa CDC, Ministries of Health, development partners, and many other organizations from the private sector, both commercial and non-commercial. This is what drives us at AHB.
Wow, that's interesting. And, given that historical perspective of how the private sector has really been, crucial in coming together as coalitions, just like you say. And interestingly, I would want to know your thoughts about how, despite all these efforts over the years, like you've discussed, it seems African health systems remains fragmented. Right, yeah, because...
Yeah.
And I'm curious to know, in your thoughts,
Yes.
What must be done, right, to address these systemic gaps, and how can the private sector play a stronger role in ensuring equitable access to healthcare?
This is not a new conversation. And this question that you ask has been asked for quite a few decades. This tells you that the answer is complex. And because it's complex, it requires all hands on deck. And it requires everyone working towards a common goal in an organized, synchronized, effective manner. So, what must be done is your question. I think two real big things needs to be done is leadership and finance. And if you put everything in the leadership and finance, you will realize that countries, communities, and regions will have a stronger health system. I'm talking about leadership in both public and private, both state and non-state. And as many leaders take office, either through elections, or by appointments, or by selection, we need to take responsibility of the ministry that's under our control. And health is such a complex sector that it needs to work with other ministries very closely, like the Ministry of Water in some countries, Ministry of Sanitation, maybe Ministry of Gender, Ministry of ICT, Ministry of Science. So you can see the intercollaboration. Health cannot be dealt with like a vertical sector, singularly. The leadership also requires ensuring that the voices are heard and priorities are listed appropriately on what the countries are facing. It could be health workers' issue. It could be supply chain issues. It could be making sure we have the right electronic medical records. It could be vaccines. It could be essential drugs. So if you go into the sector, it's quite vast. And so leadership will require strong champions at the ministries of health to identify, organize, and implement solutions that are fit for purpose for the country. And it needs to be incrementally increased. This is also important because if they demonstrate great leadership and great strength and great impact, they can go forward to the ministers of finance and ask for a bigger budget. At the moment, the budgets given to the ministries of health in Africa are less than a third of what they need. With this resource constraint, they have to do a lot more. Now, to convince the ministries of finance about the impact health can have, this kind of strong partnership, interministerial collaboration is absolutely critical. 21 years ago, in Abuja, leaders congregated here and agreed that the Ministry of Finance should allocate 15% of the budget to health. 2 decades later, we haven't done much. Only 6 countries in the duration of this time have ever reached the 15% mark at one time or the other. This shows the declarations are good, but if the implementation does not work, then you have a dented health system. This is what we are facing. And therefore, the private sector comes in and walks the journey and says, we can invest into the health sector. We can look after a part of the health systems in the country while the government looks after the other part. And the development partners and all the donors come in and provide the much needed assistance that we need. So at the moment, all health systems are working with what we call a mixed financing system. We get financing from different sources, and that pot is what helps the African health system. So there's a lot to go, but I wanted to cover 2 points. Leadership is important, and the second is finance.
Apt. This really fits quite nicely into my next question. And the way you captured it, leadership and finance. So I want to focus a bit more on finance now. And the way you mentioned that only 6 countries have ever met the Abuja Declaration at one time or the other. And now I think just about 2 countries, Rwanda and South Africa, have met it consistently. So what then would you say are innovative financing strategies or public-private mechanisms that countries can explore to scale health investments sustainably?
We've definitely got to explore a little bit more than the donor agencies, which, by the way, have played a good role, but you can see that there's a declining support. So we need to bring up the private sector funding through various models. We need to bring investments through different models. Let me give you some examples. Literally, I think there are 3 or 4 real good areas for us to focus on. The first is investment bonds and health bonds. Like we've done for infrastructure and we've done for telecom and energy, health sectors lag behind in health bonds. So social bonds are a little tricky. But if we can create a nice and a very integrated health bond, it would help several countries come out of the debt situation and potentially add into the total health budget. The second area is driving an enabling environment for better and stronger private sector investments. Hospitals can be built, factories can be built, we can have more diagnostic centers. So health services is a great area for private sector, stronger investments. We've seen banks like Afrexim Bank, African Development Bank, and I must, appreciate some of our local African banks who are stepping forward to ensure that we have medical centers of excellence, like the one here in Abuja. And if we can replicate this, and we can have 5 or maybe 10, we will deliver the best healthcare on African soil for the people of Africa. Maybe that will reduce costs and maybe even enhance quality. That's the second side. I really think private sector has a role to play. The third is around the whole philanthropy aspect. It's important to give this directed and an intentional attention. There are quite a few African institutions and individuals who would like to step up and do something and make a difference in health. What we need to show them is how and where. And there should be clean transparency, there should be integrity in the funds that help women's health, child health, looking at cancer, looking at infectious disease. So these are the sort of pockets that I believe we need to look at. And bringing a mix of all that is what people sometimes call the blended finance approach.
Yeah, interesting. And, for financing, it's really dependent on real-time, evidence-based I mean, financing has to be evidence-based, basically. But the challenge is that there's still various gaps, right, in health data and evidence. Yeah. So the question now is how can both the public and private sectors help strengthen the health data and research ecosystem such that it supports the necessary investments, the kind of investments that you've spoken about?
You know, the sector has been manual for many years. So manual that we've had notes being written on books. We've had names of patients on manual registers. And we've had prescriptions being stored on paper. You remember all that?
Yeah.
I am very pleased to see that the movement of digital or digitization is rapid in Africa. So I think we need to give that time. We need to digitize records. We need to have a system in which we have connectivity, we have electricity, and maybe using the phone more effective. I see the movement being so rapid, and I am looking forward to the next 5 years where we will be having better data. Data has been a problem because it's been manual. It's been difficult to collate the data, aggregate the data, and share the data. Now, with digitization, all the three areas of the data will be much easier. There's still a cost element around data that we need to be a bit mindful of. But with the connectivity costs, broadband costs, internet costs, and maybe electricity costs, and applying solar, you will see many, many more connected health solutions that will enable us use data. So we need to do basics first. First, we need to get digitized. You will see automatically many organizations will start becoming solution providers in digital health. And that will begin an unstoppable cycle of digital health solutions across. This is what I believe will be the secret to data solutions. Then when we have data, we will have the right numbers, the right opportunities, and the right risks. This will let both public and private sector move to the next level.
Data-driven approaches.
Data-driven approach, absolutely.
Fantastic. You have quite spoken well, actually. You've touched on really critical areas, and you have also been you've worked across the high level, policy. You're the previous chair of Kenyan Healthcare Federation, and now your role in private at AHP. The question now is, what has been one moment or a decision that has really, reaffirmed your belief in Africa's potential to lead and drive innovations to strengthen universal health coverage in Africa?
Woof. There are many such moments, but there was one moment where I had top leaders from Africa Union, Africa CDC, WHO, Ministry of Health converge onto a document and endorse the unification of non-state actors being critical in changing the health systems in Africa. This happened in Johannesburg. And this was about 2 years before the pandemic, around 2018. And I know the moment because the then minister, who's now again the Minister of Health, Aaron Motsoladi, Amira El Fadil, together with so many ministers and leaders, came together declaring that private sector counts. We had the Minister for Health from Liberia, Wilhelmina Jala, who said, being in this 2-day forum is like being in a classroom. I have learned so much more about what I need to do in Liberia. The defining moment wasn't because they said things at the time we met, but I saw them implementing it when they went back. Liberia is one such example, where the combined forces are saving lives. Private sector, which was never on the table, is now in the policy organ making decisions, offering solutions. It's going to continue. So you see, these are now defining moments. You're making changes step by step, community by community, country by country. So if we have to go through the continent, the defining moments, let every country get its shape right. Let it work with both public and private. Let it find the most opportune moments to make a difference and improve health.
This has been very insightful, and I hope that the 2-day symposium will be one of such defining moments that we can move forward and ensure that it's backed by bold implementation strategies. Yes. Thank you so much. It's been a pleasure having you on the show.
Thank you.